All right. Thursday. I think that's 4 this week. I don't know. Doing a lot of live videos. Have more time. So, question came up about really the cause. What causes back pain? So this video, very, very important. If you have back pain and you're not getting better, you need to pay attention because this is the truth. This is why you have back pain. Most common reason of why you have back pain and what you need to do to fix it. It's pretty simple. When I make decisions about what we're doing for our patients, it's based on science. Okay? There's a lot of confusion about the spine, but in reality, the more you know and the more you understand, the more likely you are to get better. So I always look to the literature. And the question is, what does the literature say? So we're going to talk about that in a minute. But this is how I do the business of back pain. Okay? It's based on science. When I say the business, it's about the process to eliminate back pain. What I have here is a hanger. And this was a hanger for my golf shirt. And I'm not golfing today because we've had so much water that the golf course is underwater. So I'm doing a live video. But this is a metal hanger. Obviously made of metal. And I'm going to bend it because this video is about what happens to the spine. Now, there's 24 vertebrae. The vertebrae are the bones. And in between each bone, there is a disc. And the disc allows for motion. And there's a lot of motion that takes place at the disc. The disc is a lot like a jelly donut in the sense that the outside of the disc, there's a thick material. Inside the disc, there's a jelly. And the jelly gives stability to the disc the same way air gives stability to your tire. And the jelly allows for the disc to move. All the motion of the spine takes place on top of the disc. So the disc is designed to move in 6 directions, forward to back, sideways, and rotate. A little bit of rotation in the low back, but the other parts of the spine, there's rotation. But it's this constant motion over time that will start to weaken the annulus, the outer portion. And when the annulus starts to get weak, very often the motion will force the nucleus out. And as it forces it out, this portion of the annulus will get aggravated. And you'll start to develop a little tear. Well, why does it tear? Because the tissues with repeated motion will get weaker. And as they get weaker, they will start to tear. And as they tear, the nucleus will start to push out. And as it pushes out, you'll develop a bulging disc, and then you'll develop a herniated disc, and then you'll develop an extruded disc. And that disc over time will start to get weaker through repeated motion. Over time, progressively getting a little bit weaker every day. And there are certain motions that you do every day that maybe you don't need to do, or maybe you're doing them wrong. And when you move wrong, and you put your spine in the wrong position, or you sit too long, and you don't let the tissues readapt, then what can happen is slowly the tissues will get weaker. And as they get weaker, this is dangerous, as they get weaker, slowly they start to give out. You say, I don't understand why my back pain is not getting better. Or I'm getting therapy and you're doing exercises that maybe are aggravating it. It's not uncommon that you get exercises that make you worse because everybody's slightly different about what exercises they need, but also about what motions cause their spine to get weaker. So over time, as it gets weaker, the nucleus pushes out further and you start to aggravate the nerves. Then you start to get sciatica. Well, the question is, why is all this happening? It's happening because the tissues over time with repeated motion will start to get weaker. And as they get weaker, eventually what happens is they give out. And when it gives out, what happens is it breaks in half. Okay, and this thing doesn't want to break. So what does the literature say? Literature says flexion and extension, bending back and forth, forward and back, can cause herniated discs. What they did is they put discs under progressive loads and they moved them back and forth and back and forth. And what happened is eventually the disc would break. The annulus would break and you would get tearing of the annulus and the nucleus would push out. So they found in their research that repetitive motion to the spine, this is the most durable, the most durable hanger I've ever had, okay? Because I've done this before. But it's that repetitive motion, there it is, eventually over time causes the nucleus to tear, the annulus to tear, and the nucleus come out. They did this study. This was published 20 years ago, almost 2001. The study was actually performed in 2000, so 19 years ago. This is the truth. So how does this matter? Well, or why does it matter? Well, first of all, the healthy disc with repeated motion that's not normal or excessive or unnecessary or poor biomechanical motion will cause the disc to break down. We've developed tips. This is part of our process. We have a 10-step process to eliminate back pain. We've been doing it for, like I said yesterday, 31 years. I've been studying it for 31 years. We've been doing it for 25. But there are tips. And what are the tips? Well, the tips are really designed to help you put the spine in the best position and avoid the activities that are going to make you worse. Okay? Has a lot to do with your bending forward, brushing your teeth. A lot of people say, oh, every time I brush my teeth, it hurts. Because you're bending on the spine in a way that's aggravating the disc. So part of our 10-step process, one of them is to develop replacement postures and movements to make healthy spine choices, sleeping, sitting, and doing the everyday activities. That's the top 10 tips. But we have a 10-step process. Number 1, identify the movement patterns that cause you pain. There's a very specific way to do this. We have a process for doing this. It's our 10X program. Increase your awareness of those movements. We did a study with a patient to identify, even when they knew that they weren't supposed to bend a certain way, how many times they bent in the way that they were trying not to bend. It was 200 times in one day. Okay, and they knew they weren't supposed to do it. So number 2 is be aware. Okay, number 3 is develop replacement postures and develop a habit to get it right. Number 3 is the tips. Number 4 is stabilize. We talked about this yesterday. You have to do it in the right order. What's the order? Decrease the pain. When you feel better, you're able to do the exercises to make sure it doesn't come back, or do the exercises that prevent it from getting any worse. Okay? Stabilize, and then you decompress and add motion. Advanced disc problems, patients come to see us and we decompress and we add motion. Okay? You can do some of this at home. Daily exercise plan that includes walking. So once you start feeling better, we get motion in there. Okay, we slowly start to get the motion in there, and then we start to mobilize your hips. So what is it? It's stabilize, it's motion, and then it's mobilize, and then it's the exercises. So you do the exercises for the spine, and then the exercises for the hips. Hips are your power source for your back. And then we do exercises for functional fitness. What does that mean? Push, pull, carry, all the things you have to do that require movement. Okay, that requires your spine to help you move. And then what we do is we add exercises for increased stability in the future. Now, I'm a golfer, so we have very specific exercises for advanced routines. Okay, so more demanding activities. We have an exercise program that progresses. This is our 10-step program. The 10-step program will set you free of your back pain. Okay, we're going to be offering this online starting Monday. So Monday you can access it. So if you have any questions, put them below. If you have any comments, put them below. We solve disc problems. We get people to fly in from around the whole world, and what we do is this. Okay, if you don't do all of this, you run the risk of having the pain come back. That doesn't mean everybody needs to come see us. The advanced, maybe 5% of everybody with back pain is going to have a problem that might need more advanced decompression. 95% we can solve it. All right? So we can help the discs. Again, extrusions, sciatica, stenosis. My mission is to eliminate back pain. And the way you eliminate back pain is you understand why you have back pain. And you do the things necessary to solve it. It is fixable. If you haven't seen my MRI, I have a squish disc L5S1. I've got Modic end plate change because when I jammed it, I jumped off a cliff. I smashed the disc inside the bone. It's called Modic end plate inflammatory process. Modic 1 changes. I got better. I golf. I do taekwondo. I can run. I'm not a fan of running. I'm not saying running is not a good idea because it's a good idea. I just don't like it. I like to golf. So you can live a normal life. That's what we can do. That's our mission. Our mission is to help you. You only have a back problem that's going away because somebody gave you the wrong advice, or they gave you the wrong procedure, or they gave you the wrong technique. That doesn't mean they had bad motives. They may or may not. But they had bad understanding. With the science now, we know why you have back pain. And we've proven that our technique can eliminate the worst back problems. This 10-step program will help you get your life back. It's that simple. We're here to help you. If you have any questions, add them in the comments. Okay? If you want to talk to me, we're going to have a program where you can Skype with me so I can help you understand what you need to do to get better. I'm not going to diagnose you. It's not a diagnosis. It's not a treatment. It's a coaching program. All right? Here's our phone number, 844-577-7329 if you want the tips. TotalBackPainRelief.com/free tips. I know. We're trying to shorten it. It's too long. And relief is RELIEF. Just remember, I before E except after C. All right. Thank you.